Well, we're all being affected by measures to slow the coronavirus, but for some, the challenges are greater than others. For Australians living with a disability, being told to isolate or reduce physical contact with people is not as easy as it sounds. For more, I'm joined now by Greens Senator Jordan Steele. John, Senator, thanks for your time.
Great to be with you, Catherine.
Just to kick things off, we've seen announcements by some of the major supermarkets today to extend trading hours for the elderly or those with a disability. Is that something you welcome?
Well, it's a good start, but they need to go far further than that. The reality is that many disabled people rely on the ability of food to be delivered, either because they can't leave their homes or because they cannot interact in those highly intense spaces that are the supermarkets right now. So what I am calling and the Greens are calling on our supermarket chains to do is prioritise the resumption of those delivery services to disabled people and our families so that we can get the food we need.
Okay, so that's one area. How else can you describe to those watching, is this virus impacting on people with a disability that they might not be taking into account?
Well, I think across the Australian community there is a deep sense of worry about whether needs will continue to be met. There's a deep concern about what this crisis means for ourselves and for our families, for the people that we love, and that's across the entirety of the Australian community. What we need to see is a plan, a management strategy for this crisis that includes everyone. And make sure that people in our community that are at risk are provided with the information and support that they need in order to get through the crisis. And what is becoming clear is that we need a better plan to support those, people who are at risk. And that's becoming very clear. It's a very good example in the disability space. We have seen a shocking lack of accessible communications in the last couple of weeks, with the Prime Minister doing news conferences without Auslan interpreters present. That's a really basic thing. There is currently no national coordinated plan to ensure that disabled people can continue to receive the supports that we need via support workers as the crisis develops. And there is no nationally coordinated plan to make sure that when we get sick, we can get the support that we need and the healthcare services that we need when we need them. And that is just not good enough.
And more specifically on that last point that you spoke of there, I believe one of your concerns that you hold is that perhaps those with a disability might be triaged lower. Is that right?
Well, that is one of the concerns. I hold it for disabled people, I hold it for older people, and I hold it for First Nations people as well. If you take those cohorts together, that is a massive part of our community. People, are very worried about what we are seeing in countries like Italy, where disabled people are basically being, asked to go to the back of the line, and that vulnerable people across the community are not receiving the supports and information that we need, and that is something that we cannot let happen here in Australia. And if we act urgently now, if the government takes an integrated, coordinated response, then we can make sure that vulnerable people who are at risk are supported through this crisis, and that is what the Greens are calling for.
And is there another concern regarding staff? We know that those with a disability rely on perhaps not just one but numerous staff to help them live and thrive in their life.
Yes.
What are you asking for with respect to keeping the health of that support staff well?
Well, what we need to be doing is using the various data sets that exist across the country in relation to what the support needs of disabled people are, where we live, where the workforce concentrations are, and combining that together with information about the healthcare system to ensure that disability service providers are supported, that NDIS participants are supported, to maintain those critical functions. Because the reality is that for many vulnerable communities, including disabled people, we need supports day by day to continue to live. Folks need to help us do our shopping or to help us move around in the night so that we don't get bed sores. There is kind of a disconnect here. We cannot completely socially distance because we need to interact with people to be able to just get by day. And that's why we need a comprehensive, coordinated plan to support that workforce to continue, to support disabled people to continue to be able to access what we need as the crisis develops.
Greens Senator Jordan Still. John, many thanks for joining us.
Thank you so much.